Every classification problem begins with a collection of observations. In this case, each point represents a patient. Along one axis is the body temperature and along the other is the white blood cell count. Green points represent a healthy patient, red points represent a patients who are sick. Even before doing any mathematics, your eyes naturally begin searching for a pattern. At first glance, the two groups seem fairly well separated. But look a bit closer. Healthy patients appear among the sick ones and the sick patients appear among the healthy ones. Those few exceptions are exactly what make the classification difficult. So how should we separate these two groups? If you were making this decision by yourself, you would probably begin by asking the simple question. A question that divides the patients into two groups. Is the patient's temperature greater than 38 degrees Celsius? Patient on one side satisfies the condition and the patient on the other side doesn't satisfy that. It isn't a bad question. In fact, it gets many patients right, but not all of them. A few healthy patients still end up moving on the wrong side and a few sick one remains on the other. So perhaps we have simply asked the wrong question. Then what question should you ask? We asked one question, it wasn't terrible, but it certainly wasn't perfect. So naturally, what if we asked a different one? Maybe the temperature isn't the right measurement. Now let's take a look at white blood cell. Perhaps white blood cell count tell us more. At first glance, this actually looks better. Which one should we choose? Looking isn't enough. Our eyes are good, but they are subjective. We need a way to measure what better actually means. This is the motivation. Every circle point represents a patient that this question would classify incorrectly. Fewer mistakes means a better question, and that is that simple. Now, we can finally compare them objectively. The second question simply makes fewer mistakes. Once we can score a question, nothing stops us from trying another question, and similar another and another. Every threshold, every possible split can now be evaluated automatically. Eventually, one question stands above the rest, not because we choose it, because the data did. Even this split is not perfect. About 3 healthy patients still end up with a sick group. But among every simple question we tried, this one loses the least information, and it almost separates the two groups almost completely. We found the best split line, but what does best actually mean? Here's the cut we landed on, a single line at 7200. Above it mostly sick and below it mostly healthy. But look closer, it's not perfect. A few healthy points are on the wrong side of the line. Now forget this specific line for a moment. Instead of focusing on one chord, we need to understand what makes any chord good or bad. At first, imagine no split at all. If I pick a random point, I have no idea whether it's healthy or sick, and this system has maximum uncertainty. Now if we introduce a chord at 6000, it helps a bit. Each side starts leaning towards one class, but both sides are still mixed. Now we return to our 72 to 100 chord. Each side is much cleaner and I can predict the level with high confidence. So instead of asking which line look best, we need a way to measure how mixed or pure each split is. For that, we need to think of data like a gas. Red and green particles constantly moving and colliding and they are completely mixed. Now imagine if they begin to separate, the system moves from disorder to order. And physicists already have a name for this. This phenomena is called entropy. Entropy isn't just a level, it's a scale. At high entropy, everything is mixed and the system has maximum uncertainty. At lower entropy, the groups are cleanly separated and the system is said to have some order. And the good split is the one which pushes us toward lower entropy. And now let's compare these two worlds. On the left, everything is lumped together, and on the right, the same data but split at 7200. As you can see, there is uncertainty on the left side of data as there is no split decided and the data are mixed. Whereas on the right side, the split at 7200 nearly separated the data completely and the system has lower entropy. The difference between these two states is how much uncertainty we removed. This reduction has a name and it is called information gain. A single question already splits the data. At 7200, the points instantly separate into two regions. But separation alone is not enough. What matters is how clean the separation really is. So we zoom in and focus only on one region at a time because there is where certainty hides. So we take the upper region. First attempt, a simple horizontal cut at WBC greater than 9500. But the result is highly mixed. Both sides remains noisy. Next idea, let's try a diagonal separation. It just improves the thing slightly, but still fails to fully separate the groups. So now let's try the next split. Then something much simpler works better. A single vertical cut almost perfectly separates these two groups. One side becomes almost entirely one class and other side becomes the opposite. And this is the cleanest separation so far. Now we step back from the individual splits and look the pattern they form together. Each split become a decision point. One question divides the data and next refines it further until the groups become nearly pure. What we are seeing is a system that repeatedly chooses the best split at each step, and this is the actual mechanism behind it. The decision tree can grow complex based on the data we have. For example, just take a look at this decision tree. Compared to our decision tree, this is very large and it asks many questions. So decision tree is subjective to data we have. Picture a decision tree, a flowchart of questions. Each question splits the world into true or false. This one asks, is the white blood cell count above 7200? If yes, we ask a second question, is the temperature above 37.6 degrees Celsius? And depending on the answer, we predict whether the patient is sick or healthy. Suppose we have a new patient whose temperature is 38.8 degrees Celsius and white blood cell count is 8400. Now let's take a closer look how decision tree evaluates. The first question, is 8400 greater than 7200? If the result is yes, the answer is clear. Follow the next branch. Now the patient meets a second decision point. Is the temperature greater than 37.6 degrees Celsius? As 38.8 degrees Celsius is greater than 37.6 degrees Celsius, answer is true and it follows the branch 2. As there are no more questions to ask, it has a diagnosis and it gives answer that the patient is sick. We had one patient, two questions and one prediction. Now watch what happens with more patients. Every question in a tree corresponds to a boundary in space of our data. The first question, WBC above 7200, draws a horizontal line at 7200. The second question, temperature above 37 degrees Celsius, draws a vertical line at 37.6. Now patient 2 arrives with temperature 36.5 degrees Celsius. White blood cell count 8500 and the tree predicts the patient is healthy. Now let's take a look at what happens when patient 3 arrives. As we see, the patient turned out to be sick based on the data of temperature and white blood cell. And the next patients arrive with temperature 38.2 degrees Celsius and white blood cell count 4500. And the tree does its work and gives us the result the patient is healthy. The tree doesn't even ask the second question. The boundary has already decided. And there's the decision boundary. 3 patients, 3 different paths, 3 predictions and all encoded in simple lines. The tree has learned to partition your data into regions. Each region gets a label. And finally, this is how a decision tree works. A decision tree is simply a map of the data, just questions, answer, and the boundaries.